Welcome to the Basic Obstetric Ultrasound Training Course for Healthcare Providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials available at tinyurl.com/UW-ultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams-Waldorf, and I will be narrating the 6th video in our Pregnancy Ultrasound series. This video will teach how to determine the gestational age of a fetus in the 2nd and 3rd trimesters. Please visit our website for access to all of our video and training materials. In this lesson, you will learn 3 important skills. First, you will learn how to measure the head, abdomen, and femur to find fetal age. This involves learning how to find the correct level for each structure. Finally, you will learn how to choose the best ultrasound images to determine fetal age in the 2nd and 3rd trimesters. Many women don't know their last menstrual period, so ultrasound can be very helpful to determine the age of the fetus. Accurate dating is helpful to manage a normal pregnancy and determine if a birth occurs too early or if the pregnancy continues much after the due date. It is also essential to determine when you can safely do a cesarean section so that the baby is not born too early. Using fundal height alone to date the pregnancy can give a false due date in the case of twins or with increased or decreased amniotic fluid. Ultrasound can easily identify these conditions. Note that 1st trimester dating is more accurate than dating performed in the 2nd and 3rd trimesters. Remember to never change the gestational age or due date later in pregnancy with a 2nd ultrasound if you've already obtained dating with an earlier ultrasound. In the 1st trimester, we use the mean gestational sac diameter and crown rump length of the fetus to date the pregnancy. We will discuss how to do this in a future lecture. In the 2nd and 3rd trimesters, we measure the head, abdomen, and femur. Remember that we never want to use images that aren't the best possible. Sometimes images aren't optimal because there is decreased amniotic fluid or the fetal position is not ideal for the measurement. To be most accurate, it is best to measure each structure at least 2 times. When measurements are entered into the OB worksheet on the ultrasound machine, the machine will calculate the gestational age and estimated due date. Older machines may not have obstetric software packages. In this case, you can use charts to get the dates for individual measurements. The charts have the same information that is used by the ultrasound machine. We will start with measuring the head. We will learn 2 ways to do this, by taking the biparietal diameter and the circumference. Diameter is the width of the head through the middle. Circumference is the measurement around the outside of the head. Remember that we talked about the brain at different levels in the anatomy lecture. The biparietal diameter, or BPD, is in the middle of the brain at level B. Measuring the biparietal diameter accurately involves 4 steps. First, you must measure at the level of the thalamus and cavum septum pellucidum. Make sure that the entire skull looks smooth and oval and that the brain structures are equal on both sides. Measure from the outer edge of the skull to the inner edge. The line between the cursors should be perpendicular to the falx. The two most important factors in getting this measurement right are finding the proper level at the thalamus and CSP and seeing that the head looks oval in shape. It is more important to clearly see the thalamus than the cavum septum pellucidum. We will now show you 4 examples. This is a transverse view of the head. The cavum septum pellucidum is towards the front of the head. Notice that the CSP looks like 3 white lines here. The thalamus is near the middle and has a heart shape. The falx is a strong white line that is in the middle of the head, but at the correct level to measure the BPD, the falx does not run continuously from the front to the back of the head. The falx should not be visible in the back half of the head. The head can be in various positions. It is most important that the head be oval in shape and to scan at the level of the thalamus. Here is the thalamus. The CSP is also present here, but less distinct than in the previous image. The image on the left is a fetus at 22 weeks, and on the right, a fetus at 32 weeks. The cavum septum pellucidum looks somewhat different in both images. We have outlined the CSP in both images to make it more obvious. On the left, it looks more like a black box than 3 white lines. Both images are accurate levels for BPD. Can you find the thalamus in each image? Please pause the video now to invite the group to find the thalamus in each image. Once you have good head position, you can now measure the BPD. We want to measure from the outer edge of the skull to the inner edge. It is very important to be precise. If the measurements are not precise, the gestational age estimate will be wrong. Here is another image to identify the falx, cavum septum pellucidum, and thalamus. Please pause the video now to identify each of these structures. We have outlined these structures here to make them more obvious. The line between the 2 calipers should be perpendicular to the falx at the widest portion of the skull. In these measurements, the lines between the calipers are not perpendicular to the falx. The measurements will be incorrect. This fetus is only 15 weeks and 5 days. Can you see the thalamus and CSP? Please pause the video now to look for these structures. It can be very difficult to see the CSP before 18 weeks. Note that the dashed line representing the measurement of the BPD is perpendicular to the falx. The calipers are located on the outer and inner edge of the skull. Here's another example of how the BPD measurement is perpendicular to the falx and the calipers are located on the outer and inner edge of the skull. The image also shows you how the BPD and gestational age will look on the computer. We see here that the BPD is 6.27 centimeters, which means that the fetus is 25 weeks and 3 days old. Another way to judge your image is by looking for ventricles. Ventricles are seen best at level A. Ventricles are near the top of the head. Please note the lateral ventricle in this image. Ventricles contain fluid and tissue that makes fluid. The fluid is black, and the tissue that makes fluid, the choroid plexus, is echogenic and bean-shaped. This plane is too high to measure the BPD, so the measurements will be falsely small. Notice that the falx is continuous. Anytime the falx is continuous, you know the level is wrong to measure the BPD. You also cannot see the thalamus or CSP. Can this image be used to measure the BPD? Please pause the video now to discuss within your group. The answer is that this is the wrong level to measure the BPD for several reasons. The level is too high because you can see the ventricle and choroid plexus. The falx is almost continuous, and both the thalamus and CSP are missing. Please pause the video now and ask for a participant to identify the thalamus and CSP. We have outlined the CSP and the thalamus here to make the structures more obvious. What is this structure? This is called the cerebellum. It is at the back of the brain. If you can see the cerebellum, you know the level is too low to measure the BPD. The cerebellum is at level C, which was the level of the last image. This is another view of the cerebellum. Look for the shape of a very fat 8. We have outlined the cerebellum here to make it more obvious. This is the correct level to measure the BPD. We cannot see the cerebellum at this level. Notice the correct placement of the calipers to measure the biparietal diameter, one on the outer and one on the inner edge of the skull. The dashed circle on the outside of the head measures the circumference, which we will talk about next. It is okay to have both of these measurements on the same image. The guidelines for an ideal image are the same to measure both the BPD and head circumference. The second head measurement we should take is the head circumference. We measure at the same level as BPD. It is important to measure just outside the outer margin of the skull to be accurate. Do not include the skin. The entire skull should appear smooth and oval. We will demonstrate this during hands-on practice. As you do with BPD, always measure at the level of the thalamus and the CSP. Note that the ellipse is on the outer edge of the skull. Here is another example. Please pause the video now to ask a participant to point out the thalamus, CSP, and comment on the caliper placement for the BPD and head circumference ellipse. The following slides show the appearance of the head circumference at different gestational ages. This image is at 16 weeks. At this time, the structures are small and sometimes hard to see. This image is at 32 weeks. It also becomes hard to see the landmarks as the baby gets closer to the due date. Is this a good image to measure a head circumference? Why or why not? Please pause the video now to encourage responses from the group. The answer is no, because we cannot identify the thalamus or CSP. Is this a good image to measure head circumference? Why or why not? Please pause the video now to encourage responses from the group. The answer is no, the head is too small to see the landmarks well. The falx is continuous, and there is no thalamus. Is this a good image to measure the head circumference? Please pause the video now to discuss why or why not. The answer is that the image is too low to be accurate. The white structures shown by the arrows are bones at the base of the posterior skull. So this means we are too low to measure the head circumference or BPD. There should be no bright white structures in this area. You shouldn't see any bone. This is even lower than the cerebellum. The abdomen is the next structure to measure to determine gestational age. Please pause the video now to ask your trainer to show on a doll the level of the cross-section to image for estimating gestational age. Then identify the important landmarks in this image which you need to see to measure the abdominal circumference. We have outlined these structures here. They are the umbilical vein, stomach, and spine. Note the curved shape of the umbilical vein, which suggests that this is an excellent level for measuring the abdominal circumference. Can you determine the lie and presentation of the baby from this transverse scan? Please pause the video now to discuss within the group. The answer is that the baby is in a longitudinal lie with a cephalic presentation. The fetal spine is on the mother's left. To measure the circumference of the abdomen, we want to be at the level of the umbilical vein. A curved umbilical vein is the best level for measurement, but a straight vein is acceptable. Make sure that you also see the stomach and spine, and that you do not see the kidneys and bladder, which would make the measurement too low. The abdomen should appear round. The ellipse should be positioned at the outer edge of the skin. Please note that the umbilical vein is anechoic and appears black because it contains fluid. The stomach is also anechoic because it contains fluid. The spine appears hyperechoic or white because it is bone. Note how the whole abdomen appears round and the ellipse is on the outer edge of the skin. Please ask a participant to identify the umbilical vein, stomach, and spine. Answer the questions. Is the abdomen round? And is the ellipse position correct? Please pause the video now to discuss. The answer is yes, the ellipse position is correct. Structures have been labeled to make them more obvious. Please ask another volunteer to identify the umbilical vein, stomach, and spine. Pause the video now to discuss. The answer is that the umbilical vein is not visible here. The abdomen is not round and instead appears more oval. The ellipse is positioned correctly around the outer edge of the skin, but this is not an acceptable measurement because we cannot see the umbilical vein and the abdomen is not round. And we see an additional anechoic structure, the heart. Is this a good image? Notice how small this image is compared to the rest of the image. The object you are measuring should fill most of the screen. Readjust your depth and zoom to make this object fill the screen. Please ask another participant to identify the umbilical vein, stomach, and spine. Then please answer the questions. Is the ellipse position correct? And is the abdomen round? Please pause the video now to discuss. We have now labeled the structures, but what is this? The answer is that this is a kidney, which means that this is the wrong level to measure the abdominal circumference. The final task that we will discuss in this lesson is how to measure the femur length. Here you can see the femur, which is the bone in the thigh. To properly measure the femur, rotate the transducer until the femur becomes as long as possible. Please ask your trainer to demonstrate this with a doll. If you see two bones next to each other, or fingers or toes, then you are not at the femur. Here's an example of a femur length measurement. Remember that bone is white. Measure the bone only. Do not include the black at the ends. That is cartilage, not bone. If you see a point at one end of the femur marked as point A with an X, do not include it in your measurement. Measure instead from the end of the femur marked as point B with a plus sign. The measurement between the X's is incorrect. The measurement between the plus signs is correct. You can measure femur length in a young fetus starting at 13 weeks. The measurement in this top image corresponds to a gestational age of 16 weeks and 4 days. You can also measure fetuses close to term. In the bottom image, the femur length corresponds with the gestational age of 32 weeks and 2 days. It is usually easier to measure the femur that is closer to the transducer. Note that in the top image, both femurs are visible, but the femur closest to the transducer is easiest to see. Is this femur length measurement correct? The answer is yes. How could the image be improved? Please pause the video now to discuss in the group. The answer is that the image is too small. Adjust the depth to enlarge the image. What are we looking at in this image? Can we measure the femur length in this image? Please pause the video to discuss in the group. This is not the femur. It is a lower leg that contains two bones called the tibia and fibula and a foot. The structures are shown here to make them more obvious. Let's review the key points. Accurate measurements are essential to determine the correct gestational age. Accurate measurements require the correct anatomic level and correct caliper placement. If you can't see the head, abdomen, or femur anatomy well, do not take those measurements for fetal dating. Questions for review. What are the 4 key measurements you should take in the second and third trimesters? The biparietal diameter, the head circumference, abdominal circumference, and the femur length. How many times should you measure each structure in order to be accurate? The answer is 2 times. Where should you place the calipers when measuring the biparietal diameter? Outer edge of the skull to the inner edge. Which 3 structures should you see at the correct level to measure the abdominal circumference? Stomach, umbilical vein, and spine. Which structures in the fetal brain indicate the correct level to measure the biparietal diameter and head circumference? The CSP and thalamus. When measuring the femur length, where should you place the calipers? At each end of the bone, measuring mid-shaft. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause the video now to ask your instructors any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, Stacy Lissett, and Jennifer Summers. Finally, we wish to thank Dr. William Marks for the use of images from his book, Ultrasound, A Practical Approach, Dr. Sid Gosby, pediatric neurologist, for consultation, and Jennifer Summers and Jan Hamanishi for graphic design and illustrations. The University of Washington Department of Radiology has trained healthcare workers in pregnancy ultrasound in many parts of the world. If you have questions about this video or course, please contact Dr. Robert Nathan, Dr. William Marks, or Dr. Christina Adams Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies and UW Video. Please visit our website at tinyurl.com/UW Ultrasound to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original Basic Obstetric Ultrasound Training for Midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.